I can hear you. Dr. Hooper, you ready? Hey, Hoops, you ready?
I can't hear you.
You can't hear me. We're live.
Go down to the bottom where it says camera mic and see if it still says your AirPods under audio.
You can't hear me or you can't hear you? I'm on AirPods. What are you on? No bueno?
Oh, we're live. Great.
I know we're live. That's why I'm asking. I can hear you just fine. Can you hear me? Okay. We're going to actually be set up in a moment.
Can't hear you at all.
I hear you just fine.
I can't hear you.
Just do it without the AirPods.
Okay. I'm saying you may not be going. I can't hear you.
Okay. For the people who are actually watching us live as we try to get this going, can you hear me okay? If someone could put a comments out there that you can hear me, that'd be great. Can people hear us? No. Yes, they can hear us. Okay, good. We're good to go. Okay. All right. So, Hooper, you good? I can't hear you, Hoops. Oh, you okay? They can hear us. Okay, good. I don't know what's going on here. Oh, you know what? Yours says it says your mic isn't connected, Hoops. Yeah, it says your microphone is not connected. All right, guys, we'll be right back. We're going to try this again, okay? Unless, Hoops, you want to just disconnect your Bluetooth maybe? And then use your...
How about now?
Yeah. Yes, perfect. Okay, now I think we're good.
Button.
All right. Well, 2 minutes went by, and we got some people there. So Alex, Shelly, Priscilla, hopefully you're there. Priscilla, now can you hear Dr. Hooper? I can hear her. Technology is not our friend.
Oh, hi, everybody. Good morning.
Okay, perfect.
Thank you.
Okay, so on three, Wegovy. All right, Dr. Hooper, go ahead.
I was just going to put you on the spot and say, what is Wegovy and why are we singing it today?
Usually I do the interview. You want to do the interview?
You can do the interview.
All right, we can flip-flop. That's fine. There's also a request to speak about B12 and Lipo shots. Anyway, let's talk about Wegovy first. Wegovy is known as semaglutide, not a new chemical, but it is a new indication. And would you say about a month and a half ago,
got
FDA approval for weight loss. Wegovy is an injection, right?
It is. It's a once-a-week injection. Starts at a low dose, and every month you go up a little bit on the dose until you get to the full amount. So
this is a once-a-week injection to help people to lose weight. Semaglutide is in the class of GLP-1s, and there are a lot of different GLP-1s out there. How do GLP-1s work?
So GLP-1 is glucagon-like peptide, and that is going to...
So it works like glucagon? It works like glucagon.
It does. So it hits the receptors, which are fired off after we eat, and it's part of our signaling pathway that tells us that we're full and we've been fed. It also goes to some receptors in our brain that gives that same signal. In our peripheral tissues, meaning outside of our gut, it also helps with insulin sensitivity. And so these medications were originally developed to help with glucose control, but they found that it didn't drop the glucose levels. And so now they've been studying in people who are not diabetic. And that's where
the interesting thing is GLP-1s, all of these, started out of research surrounding bariatric surgery and found that bariatric surgery resulted in weight loss. GLP-1 went up, and then they figured out how to make GLP-1 in a lab. And so now we have new drugs that are FDA approved. It used to be that we could only give them to diabetics, but now we can give them to people who are just heavy. And so Dr. Hooper, you tell us what heavy means?
So the medical definition for people who would qualify for this medication would be someone who has a BMI of 27 with another medical problem like high blood pressure, diabetes, sleep apnea, high cholesterol, or someone who has a BMI over 30 and has not developed any of those other medical problems. So it's a great adjunct for some people who are looking to improve their health, who don't meet the qualifications for weight loss surgery based on their BMI. It's also something we could look at for people who've had some weight gain or stall after weight loss surgery.
So we know that bariatric surgery is the most effective and the most durable way for people to lose weight, but we also know that some people will regain some weight. And so, one of the things that we have to kind of figure out is when do we start people on medications after surgery? Because we know surgery is good, but it's not perfect.
Right. And there's not a lot of data on what to start or when to start it. Do you wait until someone's a year and a half out? Do you start early? I think those are things that we'll start to see and that we'll be looking at, as well as some of our colleagues around the country. But you kind of mentioned this with surgery. With bypass especially, we see a big jump up in GLP-1 when it's measured. We don't do that regularly because it's an expensive test. But then we can kind of recreate that with Wegovy. And
Wegovy.
Hopefully that will be helpful for our patients. He can't say it regular. I just want everyone to know.
Yeah, and if I were to say, "Hey, let's Wegovy tonight," what does that really mean? It's just Wegovy? I don't know. So easy. All right, so we are excited to bring Wegovy on board. We're going to figure out exactly how it works, in our patients. I think that one of the most common things that patients ask us after surgery is, am I on track? I mean, at least I know I get that question a lot. And we can easily track what their expected weight loss might be at 4 months, 6 months, 12 months after surgery. There's good data for that, and we can predict that based on what their starting weight was, their age, their health, et cetera. But and so maybe when people are off track, we recently had I recently had a patient who fell off track because she had a death in the family and felt like that stressor on her for about a month put her off track. Maybe she's the right person to be aggressive about starting Wegovy on. I don't know. We'll see. So are there any people who can't have Wegovy?
Yeah, there are a couple exclusions. So someone who's had a very specific type of thyroid cancer called C-cell cancer, it's pretty rare. They should not use it. People who have a family history of multiple endocrine neoplasia, which is a genetic disorder increasing risk of pancreatic tumors and thyroid and parathyroid tumors, should not use this medication. There's some cautions about people who have pancreatitis or gastroparesis already. But the biggest...
gastroparesis, what's that? That's a big word.
Slow gastric emptying.
Slow gastric.
The medication causes a little bit of slower emptying as well.
Okay. All right.
But it's pretty well tolerated, and the data for the weight loss is good, but it's not a fast medication. The study was done over about 14 months. It was 64 weeks, something like that.
Yeah.
So it's a long study, and they saw good weight loss and very low rates of side effects. And those side effects were nausea and some GI symptoms. But it's not something that you could use for 1 month and expect to have this. It's still not a magic pill or a magic injection.
And it's still not as good as a scalpel, but it has a place.
It is not as good as what we're doing today in the operating room. It's not.
But it has a place, and obesity is a chronic, lifelong disease for which there is no cure. And we have to be able to have adjuncts. I think one of the things that you and I pride ourselves on is we're both obesity medicine specialists.
Right.
And it's not just surgery, and this is a tool in the toolbox.
Right. It belongs along that spectrum for all of
Yep.
our patients potentially. So it's nice to have that extra tool in the toolbox to help us.
Okay. So insurance payments, is it free? Is it $1 million or is it free? Which one is it?
And somewhere in between those two.
Okay.
Okay. I think we don't really know. I mean, the first day we've been able to start prescribing it is yesterday. And, it's not even showing up in our electronic prescribing record yet. So it's, in general, we should always check your insurance and see if it would go through. The company that produced this has some benefits as they're trying to get patients to use it, and so there are some savings cards. But it is an expensive medication. If you don't have any coverage, I think it'll be pretty expensive.
We have some options for people who have insurance coverage for it. It'll get down, I think, $25.
Yeah, it says
with their coupon.
It says $25 for the first 6 months.
Yeah, so I think this is probably a good time to try while the company's running promotions and things are on sale, and we'll see what happens after that. And a couple of years,
she likes free. We do too, but it just doesn't work that way.
But give it a few years, the patents will run out, and they'll rename it something else.
Right. That's right.
That's the way pharma works.
That's right.
All right. Well, that all sounds good. If there's any questions out there, do you have any thoughts on Lipo and B12 shots? Oops. Dr. Hooper.
B12 shots are, they're okay. For most people, getting a good B12 within your good bariatric multivitamin that you're going to absorb orally is just fine. But we do check B12 for our post-op patients at their 6-month and yearly labs. And as needed. It's very rare for me to find low B12 in someone who's taking their vitamins.
Actually, I haven't seen it.
I don't think it's something that I would encourage people to do. I'd say save that money for something else.
Okay.
For a good bariatric multivitamin.
There you go.
For your follow-ups and labs.
Anything else you want to touch on, Dr. Hooper?
No, we're having a nice day getting to operate together, which is always a treat. We don't do that all that often anymore. So hope everyone else is having a good day. And just call the office if we can answer more questions about Wegovy or any of the other adjuncts we have or surgery. You know where to find us.
Okay. We go bye-bye.
Oh, man.
Bye, guys.